pharmacology of anti-rheumatic drugs. So these are the another class of drugs. So they are helpful for the rheumatic diseases. So rheumatic disease is occurs due to increase the fibrogen level in the blood. So due to increase the fibrogen level in the blood, so they are caused once again disorder to the arthritis. So due to that, they are suffering from the rheumatic disease, and here certain drugs are there. So they are treat the rheumatism, and such drugs are known as the anti-rheumatic drugs. So regarding the definition, so rheumatoid arthritis is also denoted as a RA. It is the second most common disorder related to the arthritis. So in the American, among 1.5 millions, so they are suffering from the rheumatoid arthritis. So rheumatoid arthritis is a one type of the inflammatory disease or inflammation causes by our own immune systems. Like our immune system is maintained by the cytokines and WC. So they are responsible for to cause of the rheumatoid arthritis. And rheumatoid arthritis is occurs due to our immune system can destroy the neighboring tissues. So due to destructions of the tissues, the persons are suffering from the rheumatoid arthritis, especially near to the joints. So during the COVID-19 era, we were taking the plenty of the kada or many drugs, so they can boost the immune. If it is excess, if our immunity is more than the normal increases, then we are suffering from the rheumatoid arthritis. So that's why, so those are on the kada, or those family members, they are taking the immune boosting drugs or immune boosting kada or certain herbal drugs. Please concentrate on the level of the immunity. You can starting, you can take the regularly, after sometimes you can give the certain gaps, otherwise, so that over access of immune system, it can damages the healthy joint tissues. So due to that, the joints are fail, then we are suffering from the rheumatoid arthritis or RA disease. So regarding the sign and symptoms, that is the, it can causes fatigue, joint pain, joint swelling, joint redness, joint warmth, then stiffness of the joints in the morning. So there is the no movement in the joints, so that is known as the stiffness of joints, then fever, and as well as the weight loss can be occur. So these are the sign and symptoms of the rheumatoid arthritis. So it can occur due to excess of the our immune system. So when the our immune system is more excess, it can destroy the our tissues. Even the excess of the immune system, it can destroy the blood vessels of the lungs. So due to that, the internal hemorrhage can occur in the lungs due to over activity or over productions of the WC. So that's why you are also concentrate, you do not increase the immunity more than the normals. So regarding the treatment, so here the drugs are mainly classified into 6 class. So that is the first class, that is anti-inflammatory analgesic drug, that is non-steroidal anti-inflammatory drugs. Example is a aspirin, phenacetin, paracetamol, then indomethacin, ibuprofen, naproxen, diclofenac, then mefenamic acid. So they are used for the treatment of the rheumatoid arthritis. So these are class belong to the non-steroidal anti-inflammatory drugs. So rheumatoid arthritis is a one type of inflammation occurs due to overactivity of the WBC cells, and these drugs, so they are successfully inhibit the inflammation by inhibiting the cyclooxygenase enzyme. So that enzyme is required for the formations of prostaglandin and thromboxane A2, and these both molecules, so they are involved in the cause of the inflammation. And here these drugs like aspirin, paracetamol, indomethacin, then even mefenamic acid, diclofenac, so they are target the that cyclooxygenase enzyme. And regarding diclofenac, it is also target the lipooxygenase enzyme. So due to that reason, so they are used for the treatment of the rheumatic disorder or rheumatic disease. Then second class drugs, that is anti-inflammatory drugs without direct analgesic effect. So successfully they can correct the all kind of the all stages of the inflammation, but they having the indirect analgesic activity. There is no direct analgesic activity. Example is a prednisolone, then triamcinolones. So these are the glucocorticoid drugs. So glucocorticoid drugs are the strong anti-inflammatory agent because they are inhibit the all type of the autocoids. So those are involved in the to cause of the inflammation. So due to this reason, the prednisolone is the most common drug used for the treatment of the rheumatic disorders or rheumatic diseases. So regarding the third class, that is the remission inducing drugs are disease modifying anti rheumatic drugs. So they are also written as a DMRADS. So these are the first line drug, first choice of the drug used for treatment of the rheumatic diseases. If person do not have any other disorder, okay, especially diabetes mellitus, if the person do not have diabetes mellitus means, so these are the first line drugs. If the person having diabetes mellitus along with the rheumatoid arthritis means, first to correct the diabetes mellitus or you first correct the other diseases, so later on you should be use the DMRD, so they can control the rheumatoid arthritis or they can treat the rheumatoid arthritis. So on that case you can use the prednisolone, but you take the precautions because prednisolone is also increases the blood sugar level or also it can cause the status diabetes mellitus. So that's why there is need to concentrate the dose on the anti-diabetic drug because prednisolone they can cancel the diabetic activity beneficial activity of the oral hypoglycemic agents. But instead of DMADO, you can go for the other anti-inflammatories. If the patient do not have any that much cancer or any other metabolic disorder, so then you can go for the DMAR, that is disease modifying anti-rheumatic drug. Example is a methotrexate, chloroquine. It is the anti-malarial drug as well as it is one of the best drug for treatment to avoid of the COVID. Even the chloroquine, it is also helpful for the treatment of the rheumatic disease. Then penicillamine, then as well as the sulfasalazine. So these two drugs, so they are inhibit the productions of the overactivity of immune systems or immunoglobulin. So those are involved in the to cause of the rheumatoid disease. Then methotrexate, it can inhibit the source of the that is a tetrahydrofolic acids or folic acid that is required for the formations of the WC or blood cells or any proteins. Then that is the next, that is the fourth class, that is the biological disease modifying anti-rheumatic drugs. So these are origin is a biotechnology techniques. So from the biotechnology techniques, so we can made certain drugs. So they are helpful for the treatment of the rheumatic disease. The first classification is tumor necrosis alpha, TNF alpha blocker. So like an example is a etanercept, then infliximab, then adalimumab. So these are analog of the TNF alpha. So their structure is similar to the TNF alpha. Or these drugs, so they are isolated from the tumor necrosis factor alpha. Then due to use of biotechnology, so they are modified, that is a factor, that factor was involved in the cause of the rheumatoid arthritis. So that factor can be neutralized with the help of the SAR. So then, so that is become the drug, it can inhibit the tumor necrosis factor alpha itself, or the structure is similar to the tumor necrosis alpha factor, then they are helpful for to inhibit the TNF alpha. It is one of the factor, it is involved in the to cause of the inflammation or to cause of the rheumatoid arthritis. So due to this property, so these drugs, so they are used for the treatment of the rheumatic disease. The next class, that is the interleukin 6 inhibitors. So this interleukin 6 is also responsible for to destroy the tissues, healthy tissues if it is activity is more, or it is also responsible to cause of the rheumatoid arthritis or inflammation. So its analog is, that is the tocilizumab. So this tocilizumab, it is the analog of interleukin 6. It is inhibit the interleukin 6. Due to that property, it is helpful for the treatment of the rheumatoid arthritis. And as well as co-stimulation factor, that is the abatacept, then Janus kinase inhibitors like tofacitinib. So it is the one of the enzyme. It is responsible for to cause of the rheumatoid arthritis or to improve the overactivity of the immunity, or it can responsible to cause of the autoimmune disorder. So that can be suppressed by the tofacitinib. So that's why tofacitinib is also used for the treatment of the rheumatic disease. So next class, that is the fifth class, immunosuppressant drugs like methotrexate. It is actually anti-cancer drug. Okay, so due to that property, it can suppress the immunity, or it is inhibit the formations of the tetrahydrofolic acid or source of the folic acid. Due to that property, it is also used for the treatment of the rheumatic arthritis. It is the first line drug. It is the choice of the drug to treat the rheumatoid arthritis if person do not have any disorders. Okay, so this is the immunosuppressant drug like methotrexate is the first line drug or choice of the drug commonly used for the treatment of the rheumatoid arthritis if person do not have any other disorder. अगर दूसरा disorder है, hepatotoxicity है, especially nephrotoxicity है, especially kidney damage है, first kidney function को improve करो, so after that you can use the methotrexate. Then azathioprines, then cyclosporine. So these all are inhibit the overactivity of the immune system, or these are immunosuppressant drugs. So they are helpful for treatment of the rheumatoid arthritis. So regarding pharmacology important drugs like methotrexate, it is a folic acid analog. It can inhibit the dihydrofolic reductase enzyme. So this enzyme is required for conversions of dihydrofolic acid into tetrahydrofolic acid, and tetrahydrofolic acid is required for the formations of purine and pyrimidine bases, and purine pyrimidine bases is required for the formations of DNA and RNA, and DNA RNA play important role in the synthesis of the immunoglobulin. If it is more immunoglobulins are formed. If the immunoglobulins are more forms means, so they can cause the autoimmune disorder or rheumatoid arthritis. Okay, so here are as well as rheumatoid disease. So here this methotrexate, it can target the dihydrofolic reductase, then it can inhibit the formations of tetrahydrofolic acid. So lack of tetrahydrofolic acid, the immune component cannot be synthesized. So due to this property, it is helpful for treatment of the rheumatic disease or rheumatoid arthritis. Then second most common drug, that is the leflunomide. It is the immunomodulatory medication. It can inhibit the pyrimidine synthesis or pyrimidine bases, and pyrimidine bases, so they are required for the synthesis of DNA and RNA, and DNA RNA play important role in the protein synthesis, and all immunoglobulin components, so they are the protein in natures. So due to that lack of pyrimidine, so those immunoglobulin cannot be formed. So due to that, they can decrease the immunity in the rheumatic diseases. So that's why they are known as the immune suppressant drugs. So regarding cyclosporin A, it is also immunomodulatory agent. It can inhibit the adaptive immune system. And this cyclosporin A, it is used so when our system can be reject the organ during the transplant. So during the transplant of organ, one person to another person, so our immune system, it can cause the failure of the new organ. It cannot be accept the new organ. So on that time, so during the transport of organ, so this immunosuppressant drug like cyclosporin A, it is used to prevent the rejections of the solid organ transplants. So it is the one of the only one drug it is used during the organ transplant from one person to another person. So where the organ cannot be fail, or where our body immune system cannot be causes the death of the organ. So where we are using the cyclosporin. So this cyclosporin A, it is also used as the anti-rheumatic drug. So next drug, it is the, that is the tocilizumab. It is humanized. It is a IgG1 monoclonal antibody. It can inhibit the interleukin 6 receptors. Then it is helpful for treatment of the inflammatory arthritis and as well as the rheumatoid arthritis. So last drug, that is the rituximab. It is also inhibit the beta lymphocytes. So beta lymphocytes are another type of WBC. So they are involved in the immune system. Its activity over means then only they can cause the autoimmune disorder. Here the drug like rituximab, it can inhibit the beta cells. So due to that, they are helpful for treatment of the autoimmune disorder or rheumatoid arthritis. Once again, thank you.